Hello, Abby. My name's Amy. May I examine your eyes?
Yes.
There are many useful signs on inspection of the eyes. An exhaustive list is given in the textbook. Look at head and eyelid position and consider the parts of the eye in turn. Look for proptosis or forward bulging of the eyeball from above. Now we test visual acuity.
Do you wear glasses?
No.
Ask patients to use their normal glasses for distance vision.
Please cover your right eye.
Ensure that there is good ambient lighting. Use the chart at its specified distance and ideally fix it so that it doesn't move. Ask the patient to cover one eye with a card and read from the top down until they can no longer distinguish the letters.
Please cover your left eye.
If the patient cannot read down to the bottom line, ask them to use a pinhole. If they cannot read the top line of the chart, with or without the pinhole, bring the chart closer until they can, and record this distance. Repeat this process for near vision.
Please cover your right eye.
Again, consider the lighting and the patient's usual glasses.
Hold this at a comfortable distance and start reading from the top paragraph.
The card is printed with prose in type of various sizes. Record the smallest size that can be read accurately.
Please cover your left eye and continue reading.
And better lighted than those of any metropolis in Europe.
Thank you.
Next, we test the patient's visual fields. Sit directly facing the patient, about 1 meter away.
Please keep your head still and look directly into my eyes.
Test for a homonymous defect with all 4 eyes open.
Please tell me when you see my finger moving.
Hold your hands out to their full extent and wiggle your fingertip.
Now.
Ask the patient to indicate when they see it move. Do this at 2, 4, 8 and 10 o'clock.
Now.
Test for sensory inattention.
Please point to the finger that you see moving.
Again, both eyes open. It is important to check both sides at the same time.
Please cover your right eye.
Test peripheral visual fields in one eye at a time.
Please look directly at my eye.
The patient covers one eye, and you shut your opposite eye.
Please tell me when you see my finger moving.
Now.
Test each quadrant separately and compare your visual field with the patient's.
Now.
You need to be seated close together so that you can hold your finger in an equivalent position for both your and the patient's eye.
Please cover your left eye. Please look directly at my eye and tell me...
Start with your finger in the periphery, out of view, and wiggle the tip. Bring your wiggling finger along the diagonal towards the center of vision. The patient should indicate as soon as they see it moving.
Now. Now. Now.
Next, we test the central visual field using a red hat pin.
Please cover your right eye.
And you close your left.
What colour is the hat pin?
Red.
Testing for color desaturation.
Please keep your head still and look directly at my eye. Please tell me when the pin disappears.
Make a rough map of the patient's blind spot and compare this to your own.
Now.
Can you see it here?
Yes.
And here?
Compare perception of the hat pin in the 4 quadrants of the visual field centrally.
Yes.
Ask specifically about color desaturation. Next, we examine the eye movements. Ask them to look at your finger, held about an arm's length in front of them.
Please keep your head still and look at my finger. Please follow my finger and tell me if you see double at any time.
Move your finger to each side and up and down, tracing an H. You're looking to detect a divergence of the gaze, which you will see, or double vision, which the patient may report. You may also detect abnormal patterns of movement, such as nystagmus, or loss of smooth pursuit. Examine the pupils for shape and symmetry.
Please look straight ahead.
Take account of the ambient lighting.
Continue looking straight ahead. I'm going to shine a light in your eyes.
Bring a bright torchlight from the side to shine on the pupil. Look for constriction of the illuminated pupil, the direct light reflex, and of the opposite pupil, the consensual light reflex. Look at the accommodation reflex and gaze convergence.
Please focus on a point on the far wall.
Present an object at about 15 centimeters.
Now look at the tip of this pen.
You should see the eyes converge and the pupils constrict as the eye accommodates. We use an ophthalmoscope to look at the retina and optic nerve head.
Have a look at the back of your eye.
Start with the patient's right eye, holding the ophthalmoscope in your right hand and using your right eye. Select lens number 10 clockwise from 0.
Please look down.
Gently retract the upper eyelid.
Now focus on a point on the far wall.
Starting at a distance of about 10 centimeters, bring the red reflex into focus. Any opacity will appear black. In this way, the cornea, iris, and lens can be visualized. Now come close to the patient's head, such that you are touching the hand you are resting on their forehead. As you do so, rotate the lenses anti-clockwise until the retina comes into focus.
Please look up.
By asking the patient to divert their gaze
Right.
and making your own movements, work your way around the retina,
Down. And left.
finishing with the fovea.
Please look directly at the light. Thank you. Hello, Abby. My name's Amy. Please may I examine your face?
Yes.
First we test sensation, starting with light touch.
I'm going to touch your face with some cotton wool. Please could you close your eyes and tell me when you feel me touch you?
On both sides, test the 3
Now.
divisions of the nerve: the ophthalmic,
Now.
maxillary,
Now. Now.
and mandibular.
Now. Now.
Repeat the test for pain sensation.
I'm now going to touch your face with a small pin. Please close your eyes and tell me if you feel it sharp.
Carefully test each of the 3 areas
Yes.
on both sides.
Yes.
Be aware that brainstem lesions may cause sensory
Yes.
loss in an onion skin pattern.
Yes. Yes. Yes.
Carefully dispose of the sharp and use an orange stick to test touch on the anterior 2/3 of the tongue.
I'm going to touch your tongue with this. Please close your eyes and stick out your tongue. Thank you. Do you feel it the same on both sides?
Yes.
You could also ask the patient to indicate with a hand when they feel you touching them. To assess the motor function, look for wasting in the muscles of mastication.
Please clench your teeth.
You should be able to feel contraction in the masseters and estimate their
Open your
bulk.
mouth against my hand.
Carefully provide resistance to mouth opening, testing the pterygoid muscles. Next, we test the corneal reflex. Draw out a wisp of cotton wool and dampen it to form a gentle point.
I'm going to gently touch your eye. Please look up for me.
Carefully depress the lower eyelid and lightly touch the lateral edge of the cornea. Look for direct and consensual blinking. Lastly, the jaw jerk reflex.
I'm gently going to tap your chin. Please
Ask the
open your
patient to
mouth
let
for
their
me.
mouth hang loosely
A little
open.
bit further.
Place your forefinger across the midline between the lower lip and chin. Look for reflex shutting of the jaw. It is normal to have an absent or minimal response.
Thank you.
Hello, my name's Ben. Do you mind if I examine you?
No.
Just look straight ahead for me.
Carefully inspect the whole face for symmetry, including differences in blinking or eye closure.
Keeping your head still. Can you look up towards the ceiling and raise your eyebrows?
Look for wrinkling of the forehead.
And now can you show me your teeth like this?
Look for asymmetry when the patient bares their teeth.
Now close your eyes and don't let me open them.
Test power by gently trying to overcome eye closure.
Now can you blow out your cheeks for me, please? And hold them out as I try to press them in.
And trying to squeeze air out through the patient's lips.
Thank you.
Hello, Abby. My name's Amy. Please may I examine you?
Yes.
Stand behind the patient for the whispered voice test.
I'm going to whisper in your ear. Please can you repeat after me what I say?
Mask hearing in the contralateral ear by rubbing its tragus.
4.
Use a variety of numbers and letters and perform the test in a quiet room.
I'm going to do the same in your left ear.
Start at about 15 centimetres. Hearing a whisper at 60 centimetres approximates to unimpaired hearing. Hearing loss should be formally measured with audiometry. Use a tuning fork to help differentiate conductive from sensorineural hearing loss. First, Rennie's test.
Can you hear this?
Yes.
Tell me when you hear it stop.
The base of the vibrating tuning fork is gently pressed against the mastoid process.
Now.
Can you still hear it?
Yes.
This has demonstrated that air conduction is better than bone conduction, which is normal. Air conduction relies on the function of the outer and middle ears.
Again, can you hear this?
Yes.
Tell me when you hear it stop.
If sound transmission through bone is greater than that through air,
Can you
then
hear
the
it?
test is said to be negative. This indicates conductive deafness. For Weber's test, you place the fork in the midline.
Does this sound louder in either ear?
No.
Normally the sound is described in the middle, heard equally in both ears. Interpretation of both tuning fork tests is more subtle than it initially appears.
Forward for me.
The Dick's Hallpipe maneuver can elicit positional vertigo due to vestibular disease. This requires a vigorous maneuver, so is not suitable for all patients.
That's plenty.
When the patient lies back, their head should overhang the
I'm
edge.
going to lie you down rapidly and turn your head to the side. Please could you look straight into my eyes?
The patient's head should extend 30 degrees beyond horizontal and rotate 45 degrees to one side.
Do you feel dizzy or sick?
No.
Watch the eyes carefully for nystagmus. It may take 20 seconds for this or symptoms to occur. The pattern of response can differentiate between a lesion in the inner ear or central nervous system. Repeat the test, turning the head to the other side.
Thank you.
We start with the glossopharyngeal and vagus nerves.
Could you cough for me, please?
An effective cough requires vagus nerve control of the vocal cords, as does producing a note.
Open your mouth for me, please, and say ah.
Look at the movements of the palate and uvula using a torch. If the palate is weak, you may be able to make air escape through the nose.
You blow out your cheeks for me, please. Just going to try and squeeze them in.
Note the left hand and the attentive ear. Also consider using the water swallow test before moving on to the accessory nerve. Begin by inspecting and then palpating the sternocleidomastoid muscles, looking for wasting or hypertrophy.
And can you look over your right shoulder for me, please? And over your left shoulder.
Carefully resisting the movement with your hand.
And swing your legs over the side of the bed.
From behind the patient, inspect and palpate the trapezius muscle, looking for wasting or asymmetry.
I'm now going to feel your shoulders. Shrug your shoulders up and stop me from pushing them down.
Again, testing power against resistance.
And pop your legs back up.
Next, we examine the hypoglossal or 12th cranial nerve.
And can you just open your mouth for me, please?
Look at the tongue at rest for wasting, fasciculation, or involuntary movement. Use a torch if necessary.
And stick your tongue out.
Look for deviation or involuntary movement,
And move it from side to side.
demonstrating active movements.
Pop your tongue back in and press it against your cheek. Stop me from pushing it in.
To test power in the tongue
And the
muscles.
same on the other side.
Then test lingual speech.
And now say, yellow lorry.
Yellow lorry.
The swallow test
you.
is also relevant.